People have been looking for the cause and cure of stuttering for more than 5,000 years. Famous personalities like Isaac Newton and King George VI stuttered at one point in their lives or another. We are far from the days when people who stuttered were asked to speak with marbles or pebbles in their mouth, or the use of an ivory fork to support the tongue. But research has also made it clear that there's no overnight cure for stuttering. Freedom from the speech disorder is a long-term goal, and the journey requires dedication, perseverance, and patience. Stuttering stems from the physiology, which is how your brain is wired, as well as the psychology of an affected individual. Hence, the treatment for stuttering works on both the speech and the emotions of a person. Treatment also depends on the age of the person who stutters and is different for children, adolescents, and adults. For a child, the speech-language pathologist can prescribe an indirect treatment approach, which is about counseling the families of children who stutter to make alterations in their own speech. These slight modifications may make pronounced changes in the child's speech fluency, or they may call for direct treatment, which involves direct interaction between the child and the SLP, with the aim of changing the child's speech to precipitate fluency. Treatment in adolescence is a little more complex. By the time a child with stuttering grows up, they become quite attuned to the negative emotions that surround their speech disorder. This brings forth negative feelings like fear, embarrassment, and anxiety whenever they have to engage in social or public communication. SLPs choose strategies of stuttering modification and fluency shaping to combat these. Stuttering modification strategies such as reduction of avoidance and escape behaviors, where individuals are encouraged to voluntarily expose themselves to tough speaking situations in a structured manner, or pull-outs and cancellations, which are meant to increase the understanding of one's own stuttering, help to desensitize the individual and reduce the negative feelings associated with one's speech. Whereas fluency-shaping strategies such as rate control, prolonged syllables, continuous phonation, easy onset, and light articulatory contact help in increasing fluency. The treatment for adults can be quite similar to adolescents, but with two major differences. The negative emotions surrounding stuttering in adults are fully developed, which makes it harder to treat. But adults also have one big advantage. They have an idea of the extent of how their speech disorder affects their personal and professional lives, and this brings with itself extra motivation for change. In addition to seeing an SLP and a counselor, adults can set their own short-term and long-term goals, like talking over the phone, answering the door, or speaking at a social gathering. There may be no miracle cure to this speech disorder, but you can always rediscover your confidence to speak at meetings or during conference calls and turn your life around with a little help from the experts. To find out more about how to improve the fluency of your speech, visit Stammeri, a speech therapy app that provides personalized exercises and instructional videos according to your needs.